Hey guys, I hope everybody's doing well, and thank you if you clicked on this video. I do tend to talk and have long videos, but I think people would click on my videos more if they were short, but I don't know. So I say this every time. I do this it's therapeutic for me to just get things off my chest, but at the same time I just want to put information out there that people might not know the answer to. Either they didn't understand their doctor, or they didn't understand anything health related that I might be able to share regarding pain and anxiety and depression, mental health overall, chronic pain. So I try to talk about one subject, but I go on and on because in this video it's going to be about Mounjaro. So this is more on the diabetes side. Usually it's, I do the pain and all that. But anyways, let me just get into this, okay? And I'm going to be looking at my notes, and if you have never been here before, I have extreme dry mouth. That's related to medications I'm on. I just read today that anxiety causes dry mouth, and I believe that because I'm nervous now, and when I go to the doctors I'm real nervous. White coat syndrome. Tell me please if anyone's ever heard of white coat syndrome, and if you have it, look it up. Because I have it, and it's almost comical. I mean, not really, but Alright, so this is going to be side effects of Mounjaro. Okay, and I looked this up online. Everything I say is my own opinion. Everything is online for people to search out themselves. I'm just doing a quick rundown. If you don't feel like searching things, and please contact your doctor, PCP, or endocrinologist doctor if you have questions regarding Mounjaro. As you know, Mounjaro is similar to Ozempic. Except for Mounjaro, I think there's like there's one more benefit than Ozempic, but they're both still good. I do want to say that since I've been on Mounjaro, I have not had side effects, which is very strange because I have a very sensitive body, so everything affects me. So it's almost crazy that I don't have any of these side effects. So I'm going to hurry up and tell you some of the side effects. And I don't think anything's too bad to the point where somebody wouldn't want to try it, at least if their doctor decided that their diabetes needed this treatment, because obviously this is like as high as you can get with treating diabetes, is this medication, okay, this injection. And it's helped me so much, guys. I say the same things. I know I'm going off topic. It's helped me lose 45 to 50, I don't know, something like that, 50 pounds. I'm trying to find a very old pic to compare myself to. I myself don't really see the weight loss. Other people do. And I know I have some loose skin, which is gross, because it's not like I was 600 pounds, okay? But, so yeah, when you, this drug, okay, here's some of the symptoms. Let me just go real quick. You risk having swelling after the injection. And I injected my stomach, and since day one I haven't had any of these issues on this list I'm about to tell you. Swelling, redness at the site, itching is one of them. If it's itchy at the injection site, like today or like yesterday, I was filming I showed myself injecting Mounjaro, just so people would have a general idea. It's a 2-minute video. Go see it. That's all. If you're curious about how you inject. I inject in the stomach. I know there's other places. You'd have to look in your paperwork if you are on Mounjaro or you're researching it. So those are just some of the side effects. Tiredness. I'm tired every day, so I think a lot of this too, I am on so many different medications with all different side effects. I feel like, I don't know if it's just a coincidence and I am experiencing some of these, so I don't realize it. Anyway, stomach issues is like the big one that I hear, okay? Stomach issues such as nausea, vomiting, upset stomach, constipation, diarrhea. I haven't had any of those side effects. Okay, again, these are all online. I searched them myself. Anything I say about anything besides what's online is my opinion. Please form your own opinion. Okay, this is just educational purposes, and I deliberately put this one last. Okay, side effect: loss of appetite. And that's how people are losing weight. That's how I'm losing weight. I mean, that along with making sure that when I am hungry, because it suppresses your appetite. So I try to capitalize on when I am hungry and make sure it's high protein. That way, what I am putting in my body, even if I'm only eating once a day because I'm just not hungry, when I am hungry enough to have a meal, I make sure that I capitalize on it and put chicken or any kind of high protein, low carb. Okay, so that mixed with the pen has helped me tremendously. I mean, I'm at the lowest weight I've been at, and I'm not kidding, guys, 19 to 20 years ago, because my daughter's 18, so it was before I had her, because I was in real good shape before I met her dad. So it's crazy. This is almost 19, 20 years ago. Excuse me. So let's see, 1, 2, 3, 4, 5, 6. There's 6 doses. I know I talked about this before, but there's 6 doses of Mounjaro. Okay, and the rule, basically, according to my doctor, my endocrinologist, you start with 2.5, which is the lowest dose. You start at 1 dose, and then every month or every 4 weeks, because there's it depends how many. If you get 1 box, like I got a 3-month supply, I have amazing insurance. But there's 4 pen needles in each box, so that would last 28 days, right? Because there's 4. There's 4, so there's enough for 4 weeks. So 28 days. Anyways, the doses are: you start out at 2.5. Let your doctor know you're done with that. Move up to 5 milligrams. Another month will go by. 7.5 milligrams. Another month goes by, 10 milligrams. Another month goes by, 12.5. And then finally, the maximum dosage is 15 milligrams. And that's what I'm on right now. Which is, I can really tell the difference of this compared to like the earlier ones. And these are 6 doses, and I've been on this about 6 months. So it makes sense that with the weight loss I've had, and I've been exercising too. So I think, doing some exercising and eating protein and healthy stuff while you're on, whether you're on Mounjaro or interested in getting on it, if you are, contact your doctor, PCP, or endocrinologist if you're interested in this. I don't know if there's a criteria for being on this. I don't know if like for instance in my case, I don't know if my doctor had to write something to the insurance company and basically say they couldn't control my diabetes. That's why she put me on this, because my diabetes, no matter what, was out of control. I was injecting Lantus, Humalog, taking metformin, glipizide, and none of them were bringing my numbers below 200. And so I want to make it clear, this is meant for diabetes. I have type 2 diabetes. This drug is for that, okay? But one of the side effects, if you want to call it, because people love it, is loss of appetite. And in my case too, my doctor knew that I could afford to lose some weight. I mean, I'm not obese, but I've been wanting to lose weight, and I've tried for the longest time, and I was plateaued at one number on my weight, and I just couldn't get past that. And then once I started getting the nerve to look at the scale, which is, I hate going on a scale, periodically I would just see the weight going on. So it's not like it just happens in a burst. It's gradual. It's gradual weight loss. Now, will she take me off of that at one point? I don't know. I don't know how long you can be on this drug, because I know people have concerns about with not having control of your diabetes. I feel like if I stop taking that, my blood sugars would be bad. Right now, they're the best. They're the best they've ever been in the last 6 months. And so I really don't know the rule or the procedures for when a patient reaches the max. I don't know if my doctors want to just continue on and on with that. I don't know if there's negative future effects, if that makes sense. Like if I keep taking it, I don't know if that's bad for me. Unless she lowered it, maybe she, I don't know. I don't know that much about the drug. I just did some research, but so whenever I have my follow-up with her, I'm going to ask her, how does that work? Like my diabetes is controlled more now than it ever was. Are you going to take me off that dosage? Because I'm on 15 milligrams, and that's the maximum. So I really don't know how that works. Because I imagine if I stop taking it, then obviously my diabetes, it's still going to need control. Just because it's good now, it's not just going to keep going if I stop the drug, if that makes any sense. So that's my concern, is that if we stop it, I'll have to do some research online, because I'm very curious if anybody out there was on any kind of these drugs, like the Ozempic or the Mounjaro that I'm on. They're very similar. If anybody's on here that's on one of them, and you were on it longer than 6 months, because I'm between 6 and 7 months. I'd really like to know if your doctor stopped you or you just kept going, because I'm 6 to 7 months, so I don't know the cutoff, if there is. I really don't know how that works. I probably should have read the papers that came with it from the pharmacy. It's hard to read those little fine print things. So, okay, so that's, like I said, this is a diabetic drug, but a side effect is loss of appetite, and like, it's crazy, guys. I used to be like an evening night eater. Like literally I would have to eat before bed. I needed carbs, okay, to make me sleepy. Despite me being on sleeping pills, I don't know, I have a tolerance, I guess. But yeah, like I used to have like a sandwich or something with carbs, and then I'd slowly get tired and I'd fall asleep. And this has been my routine for forever, because I don't get hungry in the morning. I'll drink maybe a cup of coffee, but it's rare. I used to drink 3 cups a day. Now I just drink water. It's crazy that I can wake up and not need coffee. But if somebody gets me one, then yeah, I will. And I think that's why the caffeine affects me more, because I kind of withdrew myself from, because I used to drink Diet Pepsi too. So having like a stimulant, I think my tolerance is down, which is good if I want to have a cup of coffee and I'm very tired. So okay, guys, I've been rambling on, I know. So if you're interested and if you think your blood sugar, you can't manage it, you need to reach out to your doctor, because honestly, you don't want to be where I was. Go back to the video. I'm still learning YouTube, so I have to learn how to attach other video links to one that I'm talking about right now. But go back and look for the video where I'm talking about what happened last year. I was in the hospital for 7 days last year because of my diabetes. It was so out of control. And that's why my endo doctor put me on this. Because I think she might have talked about it, but then when I was in the hospital as a patient for those 7 days, she came in and talked to me and looked at all my records. And we had a video call, and she said, I'm going to try you on this drug. It's called Mounjaro. I don't know if she picked this because of insurance reasons, because this was covered, but I'm very happy with it. I mean, this is coming from somebody that has side effects from everything. I'm very sensitive to new medications, and yeah, so I'm going to stop rambling. If you have any questions, let me know. My email is on, I don't know how many videos I put it on, come to think about it. Oh no, it's under my information. You can email me if you don't want to write anything in the comments if you have any questions. Alright, thanks for listening, guys. Subscribe, please. Come on, guys. I want to get to a couple hundred subscribers at least. Alright, bye, guys.